So from your perspective as a lawyer, was the migration of data from NHIF to SHIF lawful?
When you're migrating me from one system and putting me in another, taking me from one authority to another one, do you need my informed consent? If I go to my local dispensary here across the road, will I be able to access those services?
You are going to deduct us 2.75% of our salaries. 2.75%. You know, I'll be comfortable if I am deducted 2.75% of my salary and I know that there is no relative that is going to call me and tell me that they need medicine.
Exactly.
What are the benefits of this cover?
Normal delivery up to 10,000 shillings only.
Hey, Kenyans.
You are, unless ka unapasuliwa na mkunga.
Kenyans, we are on our own.
Yeah.
Hi guys, welcome to the rundown.
My name is Nihala Barasa.
And I'm Danun Zuko.
And today we'll be talking matters Social Health Authority, Social Health Insurance Fund, and all related subjects. But before we go there, can we hear some commotion for our new set? Anyway,
I've been looking for a chance to just let out a scream.
A little scream,
Yeah.
Commotion. Let's make commotion for our set.
Yes.
But we're very grateful to our set. We'll tag them down here. But Ndanu, where do you think we should start with SHA and SHIF? I remember when we spoke about the Finance Act last time, we started with a long sigh. So I don't know how we are starting the topic today.
Well, I would say that since the finance bill, I no longer have that sigh as much because Kenyans have been have become very knowledgeable. They're getting involved in matters of civic duty. They are enlightening people online, telling people about the impact of the various laws and the regulations that are being passed by Parliament. So I think it's not as glim as it was before. With the age of the Mandamanos, woo, Gen Z.
Big shout out to Mike Mushiri, by the way. I don't know if you'll ever watch our channel, but we stan you. Like the job you did with Civic Rise, that was absolutely fantastic, where people were explaining the finance bill in their mother tongue.
Yes,
like
that was
mother tongue?
amazing.
That was really
good.
amazing.
Yeah. So I think I would say that right now Kenyans are woke, especially in terms of issues to do with government and policy, and they are pushing back, which is a good thing. Well, the government might not be listening, but
we are saying something.
Yeah, we are saying
saying something.
The fact that we are talking is actually a good thing, and I believe that probably 2027 things might change.
Yeah, we might be able to make better decisions than we did in 2022.
Yeah.
Okay, so start us off. Social Health Act, Insurance Act.
Yes.
Yeah.
So the Social Health Insurance Act was passed in 2023. The purpose of the act was basically a framework for universal health care in Kenya. And the act basically provides the framework for the implementation of three funds. That's the Primary Healthcare Fund, the Social Health Insurance Fund, and the Emergency, Chronic,
and Critical
Illness Fund. Yeah. And then also the other purpose of the act is to also provide a framework for the operationalization of the Social Health Authority. So that will be the regulator for the social health insurance implementation. So in a nutshell, that is what it covers.
Okay. I like that overview, and I was trying to explain this nicely to my teenagers last Sunday.
Yeah.
And I was telling them, so look at the Social Health Authority as the parent.
Yes.
And then they have these three kids who are the Emergency and Critical Illness Fund, the Primary Healthcare Fund, and the Social Health and Insurance Fund. in the social healthcare insurance fund is this attention-seeking child that has so much attention around them because we have to register into it.
Yeah.
And I was also speaking to them along the lines of funding as well, because they're teenagers. Of course, I don't expect them to understand all these things simultaneously.
Yeah.
So I was telling them that think about it as you have to put, like the second born, which is SHIF, they have to look for people to give them money.
Yes.
And these are people that everybody knows. And then the ESIF, that is Emergency Critical Illness, Critical and Chronic Illness Fund, that one, government will give them money and they'll get donations.
Yeah.
And same to the primary health care fund. So that's what, that was my easy way to try to explain to them. I don't know if this works for you as an adult, but that's what I was telling them last Sunday.
I think it's a good analogy. I wouldn't mind it. I'm definitely going to steal it. When we look at the various funds, just as you've mentioned, the difference is the SHIF, the Social Health Insurance Fund, is the one that Kenyans will be contributing into. Yeah, so there will be deductions from their payroll, and also businesses will be paying into it. The model, of course, right now is they have clarity on how they're going to be deducting from
employees.
But from the rest, from the informal sector, they are not clear on it.
Yeah.
And I think that's one of the biggest problems that people are having, because previously the NHIF was sort of, I would say, voluntary. Yeah. So it was up to you to join the fund, to register and join the
to
fund.
Contribute, yes.
So if you're in the informal sector, if you're self-employed, then you would pay the minimum of 500. Yeah. For the primary healthcare fund, if you are going to get services under the primary healthcare fund, you only get services from level 2.
Level 3 going down.
Yeah, level 3 going down, basically. So you can't get services on the primary healthcare fund from level 4 going up.
Going up, yeah.
Yes.
And I don't want to kind of say the entire thing is a bad idea. I get where the spirit of it is coming from. It's like I should be able to go to my local dispensary and be able to access basic healthcare services.
Yes.
But the question we're asking ourselves as Kenyans is, we are coming from presidencies that actually healthcare meant we build a hospital.
Yeah.
It didn't mean we equip or we give them doctors or we give them medicine or that's not what that meant. So what I'm asking myself is, are we ready? And it's the question Kenyans are asking themselves. If I go to my local dispensary here across the road, will I be able to access those services?
That's actually a very interesting question, because I think one of the biggest problems is the government has rolled out the SHA without preparing the medical facilities. Because first of all, NHIF still owes the health facilities
Money, exactly.
a lot of money.
A lot of money.
Yes. So when you expect that the health facilities will just roll over immediately and get in and fall in line with this new program, it's very difficult.
They will not. And you see, this is actually a chance for them to enter into new contractual agreements.
Yes.
They can choose to say, by the way, we're not entering into contractual agreements with you. You're not purchasing products and services from us because this your sister that you just killed still owes us money.
Your sister that you just killed.
You just murdered still owes us money.
Yes.
So we don't think that you probably will be able to help.
Up. When the CS for Health was put to task to explain the whole implementation of SHIF and SHA, she was there mumbling. Like, you could see that she's biting her tongue, that she can't properly explain the operationalization of these funds and the authority, which is very sad.
It's very sad.
And let's not forget that the court had declared the various acts unconstitutional because of deficiencies in public participation.
Exactly.
So here we are rolling out acts that people were not given an opportunity to give their views on. Even the Council of Governors also came out to say
that was so shocking.
They were not involved in the implementation of SHA and SHIF. But you see, the unfortunate bit about this country is one day the politicians come, they tell us, oh, we were not involved. or we are on your side.
And then the next day, they are
day,
voting for it.
Yes. Or they go mute.
Yeah.
It's like, pambanini na hali yenyu. Yes.
Because you see, I read that article on one of the news pages that Council of Governors say they weren't informed or they weren't included in the implementation of the Social Health Insurance Act. And I was thinking to myself, can we then say even the public adequately participated in the enactment of that bill into a law? Because if governors are saying we were left out, these are the people like after Ruto and Gachagua,
it's the governors.
Yes,
right?
That's the line.
Yeah.
And these are the people that are saying we were not included, we were not consulted, we are still asking questions around it. Then why is it that now you're coming to the grassroots to implement something that even the leaders can't bring to us? And I don't know if you are keen to watch that parliamentary committee meeting where you're saying she was fumbling.
Oh, yeah.
Some of the legislators were asking her, I want to be able to go to my local church, to my local market, and explain to them how this means testing, this coming to households to kind of determine what you earn will work. I want to be able to explain to them, this is how SHA works, this is how SHIF works, this is how the primary health care fund will work, this is how the ESIF will work. But that was not coming out clearly in her discussion. She was being asked, give us the numbers.
Yes.
She was like, we will give you the numbers. And the parliamentarians were like, you're supposed to know this stuff off the top of your head.
Yeah.
I struggle a lot, and I'm saying this with my chest again. I struggle a lot at people who are terrible at what they do every day.
Yes.
I'm like, how is this your everyday job?
And you see, that also begs the question, were medics and healthcare professionals consulted when they were documenting these laws and regulations? Because some of the limits that are being seen are very minimal. For example, having 4 visits per person for outpatient per year. 4 visits. Like, what are we going to do about 4 visits? Honestly.
4 visits.
Yeah.
So in those areas, people will tell you that malaria is a very common occurrence. I think when you go to most dispensaries in Western, it's one of the first things they test you for.
Yeah.
They'll test you for malaria, they'll test you for typhoid, and then now there's this other normal diseases. If you're telling me I only have 4 visits in a year, are you telling me don't be sick for the rest of the year?
Yeah.
And if I'm supposed to have
healthy,
what is it that you're doing to kind of limit those visits to 4? Like, are you training me in the background? Are you giving me nets? Like, what are you doing?
That's actually a very good point.
Yeah.
Because one of the areas that the Act actually covers, it says that the universal healthcare coverage is going to move beyond curative medicine into issues like preventative, wellness, mental health areas. But the operational framework is what they have not been clear about. Okay. So if you're talking about wellness programs, even the private health insurance companies have started wellness programs just a few years ago. Okay. I think a lot of them started during the pandemic. That's when they realized that there's a lot that needs to be done. So the government needs to also tell us, in terms of preventative healthcare, what are they planning to do? What type of awareness programs are they going to implement? And then on top of that, now tell us, in terms of wellness, how are you going to train us on wellness? Is the government going to be paying for us gyms?
That's what I'm asking. Like, are they going to give us a truck like Rwanda, to run so that we can maintain low body weight and then body fat and be healthy?
True. And even some of the things that you're talking about, have they looked at the demographics in different areas and done their research to understand what are the diseases that are prevalent in those areas and how can we prevent those diseases? What more can be done in some of those areas?
And you see, the challenge is there's this work has already been done. When you look at, there are some insurance, I will not mention the specific insurance company, but there's a very specific insurance cover that when you go to areas like Western, they'll heavily cover malaria, typhoid, and they'll give you a small package that even the border guy can afford, but it covers these basic things. And then probably if you move to an area where they get diarrhea a lot or they have like waterborne diseases, they'll probably cover that. I've only seen the one for my region because I come from Kakamega. I've only seen that cover and it works for them. They're like, this is what we are covering. We'll not cover everything, but in case you have malaria, typhoid, pneumonia, and associated diseases, you can come and you can get covered. Is the government ready to enter into that? And even they don't even need to. All they need to do is go and say, hey, Ndanu Insurance Company, we know you have this data.
Yes.
Do you feel like this is data you want to share with us? Can we work with you within the confines of the Data Protection Act with your customers for us to be able to give this cover, to devise a cover for ourselves or get this data to be able to improve SHIF and SHA?
Exactly.
Yeah.
I think another question that was being raised by a lot of Kenyans is the cost of the implementation of the IT system that SHIF is going to use.
Or the digital health superhighway.
Yeah.
The digital superhighway.
Why?
I was like, this is such a fancy word.
Such a fancy word. Anyway, mtajuaje president wetu ako na PhD. So,
where? Don't censor us, please.
yeah, we outsource a lot in Kenya. So this deal is being rumored to be going out to foreign companies. And the question people are having is, when you look at the private health insurance companies, they are using certain providers for access for their customers.
Yes.
Did you go to these companies and ask them if they can be able to handle the numbers for SHIF? Because these guys already have developers who know how to handle health data, who know how to deal with medical service providers, who know how to deal with health insurance companies. So before you left Kenya, did you talk to this company?
Exactly.
Yeah.
Because they have the systems, they have
Yes.
the background, they have the products, they have the product innovators.
Exactly.
They know how to fix the bugs in those systems. All you needed to do is just go and say, you know what, insurance company X, give us a piece of the pie.
Yeah.
We'd like to understand how does this work. But also, you see, the challenge with Kenya, I feel like sometimes we rush because we have a deal outside.
Yes.
We rush to make laws about it because there's an entire act about
Yes.
it, the Digital Health Act.
I saw that.
Yeah. We rush to make laws and implement things that might not work in the long run.
Imagine.
I was thinking about it, even the whatever random system NHIF has right now.
Yeah.
What is wrong with looking for Kenyan developers, experts, system experts, and telling them, look at this system. Give us the best solution. Is it working? Is
Yes.
it not working? Like, was there really a need for us to do this digital superhighway? Some of us skeptics are like, this is a way of you mining our data.
Yeah.
I'm sorry. Like, that's
It's
how we are
true.
feeling.
It's true because even on that issue of data mining, when they say that for the informal sector, the government said that they will do surveys to understand how much the informal sector will be able to contribute to SHIF and how much the unemployed households will be contributing to SHIF. So how exactly are they going to do that survey? No, that's the first thing, because it means that they're going to be mining the data from our bank statements or our M-Pesa statements.
Exactly. From our businesses.
Yes.
And I had,
Yes.
again, this is heavy rumors. A part of that means testing is, I've not interacted with it, but you have to input maybe what you earn. Sometimes some of them is like, how many cows do you own? Like if you have a motorbike, that's what I had. I had, like if you have something like assets, basically, let's just say assets. And you see, it could be a situation where you genuinely do own 10 acres of land in the village.
Yes.
But that does not really translate into this massive source of income.
Exactly. It's not liquid assets.
It's not liquid assets. You could own that motorbike, yes, but that does not mean that now you should pay 5,000 shillings or 10,000 shillings to SHIF.
That's true.
And the danger that this is going to create is there's going to be a lot of under-declaration. It's like telling someone, kuja uniambie uko na mali kiasi gani ndo nikutax. Do you think KRA would do that?
No.
They would not. They'll come and look for that data. And it's the way you're saying now, they'll go and mine and look at our M-Pesa statements, at our records, financial records, at our bank statements, they'll go to lands and see what you own, they'll go to NTSA and see what you... That's what I'm imagining will happen.
Most
That's
likely.
where we are headed.
Yeah.
Yeah.
That's a lot. And then that brings us to the point of data protection. there was the issue of the migration of our data from NHIF to SHIF. I think a lot of us got that message.
*147#.
Yes. So, and also I think the employers had been told that the portal, they can be able to register their employees. So a lot of people have been feeling like the registration on SHIF is not voluntary. There's no consent, which is one of the key pillars and principles under the Data Protection Act. Did they seek my consent when they were migrating my data from NHIF to SHIF? No. I've not yet agreed to get into a contract with SHIF. So why would the government do that? So from your perspective as a lawyer, was the migration of data from NHIF to SHIF lawful?
If you look at Section 47 of the Act, it says all processes and services under this Act shall continue to be digitized using appropriate, reliable, secure, interoperable, verifiable, and responsive technology through information systems. 47.4. The digitization of processes and services under this Act shall mandatory conform to the provisions of the Data Protection Act and all other relevant laws. We're not the ones who wrote this Act.
They're the ones who
from
wrote it.
Parliament.
Yes.
They came up with it. They told us, yes, we will follow the Data Protection Act when we are digitizing, and that includes registering us. Then we had the first set of regulations,
Yes.
the Social Health Insurance Fund regulations of 2024. I think it was in March.
Yeah.
That provided for consent and registration by yourself to the Social Health Insurance Fund. Yes. Fast forward to 2 weeks ago, while we were busy shouting XYZ must go,
Yeah.
we were in the streets demonstrating the way a certain activist has been arrested and, all these things. They passed yet another regulation. And what did that regulation do? It repealed the first regulation and actually said NHIF shall transition all members into SHIF. So I think it's legal notice 147 of 2024. And I think it came into effect maybe on the 23rd or 24th of September, not long ago. This is like a few weeks ago. And they went ahead, following that regulation, they migrated everyone from NHIF to SHIF. What is the problem with this? When you're migrating me from one system and putting me in another, taking me from one authority to another, one, do you need my informed consent? And then number two, the other thing that part was talking about, that law was talking about, it said something along the lines of that data will be verified using other government databases.
Yes.
Does that mean then you're going into eCitizen to pick out my information to register me for SHIF that I have not agreed to be registered to in the first place?
Yes.
And when you look at it from that perspective, yes, there are data protection rules regulation. Granted, there is this law that they've covered themselves saying, you know what, we shall migrate you if you've not migrated yourself. And that's the reason why they are telling us, hit this USSD code. Because if you hit this USSD code and verify, then they look like there's an opt-in option. But that's just my speculation as the devil's advocate on this one. It gives you opt-in, or like, okay, nime dial, imeniletea this. I've completed the process, complete. They'll be like, by the way, we'll dial.
Yeah.
But how about those of us who've not dialed that USSD code? Can we then say, you migrated that data without me giving my consent to you? In my opinion, the Office of the Data Protection Commissioner should have been front, right, and center of this conversation.
Yes.
They should have told us, by the way, there's this regulation that has come into effect. In that case, this and this data will be moved from here to here.
Yeah.
This is the kind of data that will be moved. This is the kind of data that will not be touched. And genuinely, we should have been given a proper opt-in option.
That's true.
Yeah.
Yes. The next area we'll cover is the Emergency, Chronic, and Critical Illness Fund. As we had mentioned as we were starting the episode, only SHIF will require member contributions. The Primary Healthcare Fund and the ESIF will be funded by budgetary allocation from Parliament or grants and donations from wherever they get grants and donations from.
Whatever those are.
Wherever those are, okay? So basically, the most interesting thing that I found about this is when you look at the Act, it says that for you to be able to access services that are being covered by this fund, it's after you've finished your chronic or critical illness limit in SHIF. So that is when this is a kicks in. Okay. So I found that very interesting because, as we had mentioned, now the unfortunate bit is the limits that SHIF have provided for are very low limits. Okay. And also the accessibility of this fund is not yet clear. Okay. And I think it's something that also a lot of Kenyans were complaining about when the hard stop was given, that NHIF is no longer functioning from 1st of October. So now you had patients who have been going for dialysis every 2 days, twice a week, who now can't be able to go for dialysis because NHIF has been closed or murdered, as you've said.
Finished.
And then now SHIF has been born, but the baby is yet to walk. Okay. So that is also a gap that, for me, I think needs to be looked into. And people suffering from chronic illnesses need to be given a clear way forward on how they'll be able to access services. What are the benefits of this cover?
There's something we missed covering, and you will cover it.
Okay.
How much contribution is going into SHIF by employees, by salaried people.
Yes.
Anyway, let's pack that one. So this SHIF, I'll just pull out maybe the most salient features, the ones that all of us are complaining about. So the dental cover is up to 2,000 shillings per household. Per household. Like if you have 4 children, dental cover yenu ni so 5 kila mtu. You unaweza ona daktari. But do you know how you'll see that doctor? Utaenda ukae hivi umwangalia akikula lunch. That's like you just see, literally
like this. Tuonane.
Umuone, umpe so 5 uishie. So the dental cover is up to 2,000 per household. A lot of dentists, their consultation isn't even 2,000 shillings.
A lot of them, it's 3K.
Exactly.
And those are the ones who are charging minimal.
Then the diabetes cover is 4,300 shillings per year. I was reliably informed that the diabetes medication, I think the cheapest one, costs around 5,400 per year. So, obviously,
you have to dip into your
pocket. Then sickle cell is covered up to 6,800 shillings per year. And these are estimates, 6,800 shillings per year. Sickle cell is a very expensive disease.
Yes.
I don't even know how. Hypertension is 2,850 shillings a year. Nanu, do you want to comment on hypertension?
First of all, the medication for high blood pressure, that can't even cover the medication for 1 month. So how is 2,850 going to help kawaida Kenyan?
Normal delivery up to 10,000 shillings only.
Am I going to deliver in my house, then go to hospital to report that actually I've delivered?
So that you can get a birth certificate.
Yeah, because now, how is 10,000 bob going to help me? Even in Pumwani and Mama Lucy, I don't think 10,000 will be able to cover a normal delivery.
And then they said, by the way, that's normal. Is it normal delivery you stay for how long? Is it 72 hours?
Yeah.
And CS is the one that you stay up to 72 hours.
Yes, the CS is up to 72 hours.
And CS, again, this is an estimate because there are some people that I saw say 32,000, but it's around 30K. CS.
Hey, Kenyans.
You are, unless ka unapasuliwa na mkunga.
Kenyans, we are on our own.
Yeah.
What is wrong with NHIF? Because from my perspective, the biggest problem with NHIF was fraud and corruption.
Yeah.
Now, you are going to deduct us 2.75% of our salary. 2.75%. Guys, I want the CS to tell us in our households, which budget line are we going to cut when things are so tough as it is for us to be able to afford that deduction, first of all. Secondly, when you calculate that amount for a lot of people, that when you accumulate it, it's going to give you a very nice private health insurance cover.
Exactly.
But you're here giving us these jokes of limits that you went and sat somewhere in the boardroom, had tea, which one cup was 500 bob, and mandazi of 200 bob.
Or more.
Yeah. And then came up with these funny limits. And then you're telling us that you are fostering the agenda for universal healthcare. You know, I'll be comfortable if I am deducted 2.75% of my salary and I know that there is no relative that is going to call me and tell me that they need medicine.
Exactly.
That they can't afford their medicine. That everyone in Kenya is able to afford medication. But the fact of the matter is, when you look at how they want to implement SHIF, we are still going to dig deep into our pockets.
We will, for sure. We are still going to pay for private insurance.
Yes.
And let me tell you, what is going to happen in the next few months is insurance companies are going to increase the prices of their products.
Yes.
Because I'm not going to give you a product for 50,000 shillings if you're paying the government 200,000.
Come on.
Why?
We know you have money.
Yes. Why would I be giving you a product for 50,000 shillings if you're paying the government 150,000?
Yeah.
Like, make it make sense. Even if I was an insurance service provider, I'd increase my premiums. Yeah.
And that's what we are going to see over time. There's likelihood of increase of premiums from private health insurance. We are also going to probably see certain health facilities not taking the SHIF cards.
They are not, by the way.
Yes.
And they've already started.
Yeah.
They've already started not accepting anything SHIF related.
And just as we were saying when we started this topic on the difference between SHIF and NHIF, is what internal controls has the government put in place to reduce fraud and corruption in SHIF? So a few months back, the court, one of the Kenyan courts, declared the SHA unconstitutional. There were other two acts that were also declared unconstitutional alongside SHA. Could you tell us about the two acts?
So, yes, that's a good question. So the parent act was the SHA. Then there was the Digital Health Act, which is the thing that they're telling us is going to revolutionize the health sector and create a digital superhighway and health data and everything. There was that. And then there was the Primary Healthcare Act as well.
Yes.
So what the court basically said is, one, these acts don't look like they speak to the Constitution in terms of public participation. And of course, we saw the case go to the Court of Appeal, and the Court of Appeal say, you know what, go back, do public participation, streamline and make sure everything speaks to each other. Whether or not that was the right decision,
we shall leave it to
Martha Koome and her people. But yes, those were the two other acts: Primary Healthcare Act and the Digital Health Act.
Yes. And basically the main reason why they were declared unconstitutional is because there was basically no proper public participation. Yeah. Okay, guys, I think we have ranted a bit. I hope you have learned something about the implementation of SHIF. If you have any questions, you can let us know in the comment section. We will try to answer some of them, especially on Instagram. So we hope that you have enjoyed this episode, and tell us what you think about the implementation of SHIF and SHA. Okay, thank you guys for watching today's episode and listening. For those of us who are listening on Spotify. Yes, we are so glad that you're here. Please subscribe and follow us. You can follow us on Instagram at The Rundown KE, on YouTube at The Rundown KE.
On Spotify at The Rundown KE. We are both on Spotify and Apple Podcast.
Yes.
Then on LinkedIn, my name is Mihala Barasa, and you are?
Ndanu Nzyuko.
Please follow us on our personal pages as well.
Yes.
Comment on our videos. Tell us what you feel we are not doing right. what you'd want to hear more about. And I guess until we see you guys next time,
Bye.